Today, we diving into a viral outbreak that is quietly making waves in multiple countries and threatening to become far more dangerous than anyone expected. You may not hear about it often in mainstream media, but the numbers don't lie. In 2025, Mpox, formerly known as monkeypox, is making a disturbing comeback, and a new variant could change everything. If you thought Mpox was a virus that came and went back in 2022, you're not alone. But here's the truth, Mpox never left. And now, a more transmissible strain, called Clade 1A, is spreading aggressively through parts of Central and East Africa, with real fears that it may soon hit global shores. In today's interconnected world, it only takes one international traveler, one misdiagnosis, or one crowded event for a local virus to become a global crisis. The earliest signs of Mpox can resemble the flu. Fever, chills, fatigue, back pain, and muscle aches. Then the lymph nodes swell. This happens before the rash. This is a key difference between Mpox and similar illnesses like chickenpox. The rash begins on the face or genitals, then spreads. In many new cases, the virus remains confined to the genital or anal area, which leads to frequent misdiagnosis. Some people may not even realize they have it, which fuels further spread. We've seen this story before. The WHO has already declared Mpox a public health emergency of international concern, and that classification isn't given lightly. During this period, you may feel fine. That's what makes Mpox so quietly dangerous. Clade 1A appears to be more contagious, and public health experts are concerned that it could silently spread through communities before detection. According to recent reports, outbreaks in Uganda and Nigeria have already crossed borders, with isolated cases being reported in Europe and the Middle East. Just last month, over 6,800 new cases were reported along with 16 confirmed deaths, mostly in the Democratic Republic of Congo, Uganda, and neighboring nations. Now, let's break down what this virus actually is. Mpox is a zoonotic virus, meaning it originally comes from animals, particularly rodents, and then jumps to humans. It's in the same virus family as smallpox, and though less deadly, it shares similar symptoms in the early stages. Fever, swollen lymph nodes, muscle pain. Then the telltale rash, one that can turn into painful sores and blisters, often spreading across the face, genitals, and extremities. It's not pleasant. And now, some strains are becoming sexually transmissible, raising new public health challenges. Unlike COVID-19, Mpox spreads more slowly. But don't let that fool you. This virus is mutating. So how does this affect you, especially if you're outside of Africa? Here's what we need to understand. Let's talk symptoms again, not just to inform, but to empower. The incubation period, that's the time from infection to first symptoms, ranges from 6 to 13 days, but it can go up to 21. What's being done about it? In places like the DRC and Uganda, emergency vaccination campaigns are underway, especially targeting frontline healthcare workers and high-risk groups. But vaccines are not yet widely available in many parts of the world, and awareness is dangerously low. The good news? There are effective ways to prevent infection and slow transmission. Avoid close contact with individuals showing rash-like symptoms or open sores. Do not share clothing, bedding, or towels with others unless washed in hot water. Practice good hand hygiene, soap, water, or alcohol-based sanitizer if you're traveling to an affected area. Take serious precautions. People assume because it's not everywhere, it's not a threat. But what we've learned from recent pandemics is that preparedness beats panic every time. We need more testing. We need clear guidelines. And we need public education. But we can't stop there. Part of the danger with Mpox is complacency. Now, let's address the elephant in the room. Should you be worried? And the answer is not panic, but awareness. Eat nutrient-rich foods, prioritize sleep, reduce sugar intake, and avoid chronic stress. And actions that truly protect your health and your family's future. Drop a comment below and let's talk. New videos every week, with truth you can trust and tools you can use. Mpox might not be on your radar, but it should be. Until next time. By staying aware, supporting public health efforts, and boosting your own immunity, you not just protecting yourself, you helping stop a silent outbreak from becoming a global disaster. Your immune system is your first line of defense, and it matters more now than ever. Stay informed, especially if you're a healthcare worker, a traveler, or part of a community experiencing a rise in cases. Mpox is not COVID-19, but it has the potential to evolve. Viruses do that. The best protection is early detection, strong immunity, and accurate information. Speaking of immunity, one of the best things you can do is strengthen your body's natural defense system. There's also the stigma factor. In the past year, some communities affected by Mpox have experienced discrimination. Let's be clear, viruses don't discriminate. Anyone can catch it. Stigmatizing the sick only drives infection underground. What we need is compassionate public health, clear communication, and unity. Let's also touch briefly on treatment. While there's no specific cure for Mpox, the smallpox vaccine has shown strong protection, and antiviral medications like tecovirimat are being used in severe cases. But access to these treatments is limited. That's why prevention is still the #1 strategy. Here at FabAnthonyHealthTips, our job isn't just to inform, it's to equip you with tools, insights, so now it's your turn. Were you aware of this resurgence of Mpox in 2025? Do you feel equipped with the knowledge to handle it? If you found this video valuable, like, share, and subscribe to stay ahead of health threats before they reach your doorstep. This is FabAnthonyHealthTips, where real health begins with real awareness. Stay safe, stay strong, and stay informed.